Thank you for your interest in the 2019-2020 Community Health Assessment. My name is Emily Gensler. I'm the project manager, and I work for the Hospital Council of Northwest Ohio. If you started here to review the Lucas County youth data, I wanted to start off by mentioning there's an additional presentation posted to review the methodology of the Community Health Assessment. For example, you'll find information regarding the design, analysis of data, as well as response rates. Additionally, this presentation is only focusing on the youth population, which encompasses 6th through 12th graders. Please check out the additional presentations to review adult and child portions of the assessment. The full report can also be found on Healthy Lucas County's website at healthylucascounty.org. As you can see, there are quite a lot of sections falling underneath the youth health portion of the assessment. As a reminder, the data is focusing primarily on 6th through 12th graders in Lucas County, unless otherwise noted in the comparison tables. I want to mention that the full Lucas County Community Health Assessment is over 300 pages in length. We'll only be touching on a fraction of each section to give you a general overview of the type of data that you'll find in the full Lucas County Health Assessment. The first youth section that we are reviewing is youth weight status. We have information regarding body mass index, nutrition, and exercise. First, you are seeing 17% of youth being classified as obese by body mass index. Our statistician calculates BMI based on height and weight. 29% describe themselves as being slightly or very overweight. And then our last bullet, we are looking at what youth did to lose weight or keep from gaining weight in the past month, with the top responses being exercised, drank more water, and eating more fruit. Next, looking at fruit and vegetable consumption, most youth were eating between 3 to 4 servings per day of fruits and vegetables. 6% were reporting not eating any fruit or vegetables per day. Additionally, about 1/5 of youth were exercising every day in the past week for at least 60 minutes, and 18% were not participating in any physical activity in the past week. You'll see some comparison data coming up in just a few slides to see how that compares to Ohio and the United States data. Here is a graph indicating BMI classifications for 6th through 12th graders in Lucas County. To explain the graph a bit before we move forward, you can see the very first bar looking at the total percentage for Lucas County youth. Then we break down the data by gender and age. The very last bar that you see in the graph is the previous data from Lucas County's last community health assessment in 2016-2017. Those that were classified as obese are in the very lightest color towards the bottom of the graph. As you can see, those likely to be obese were those 17 years or older at 22% with the highest percentage. Here is our first comparison table for the weight status section. You'll see a black bar separating the columns. The left side is indicating the full 6th through 12th grade sample in Lucas County. And then the right side of the bar is indicating 9th through 12th graders in Lucas County. The reason that we break this up is because in order to compare to national and state level data, we are breaking out the same group as the state and nation. The CDC only surveys those in 9th through 12th grades, so in order to make a direct comparison to this data, we pull out this group. So really you can look at the data a couple of ways. One is looking at the full 6th through 12th grade sample to the left, or comparing Lucas County data to previous data or to Ohio and the United States. When looking at some of the comparisons, you can see the obesity percentage higher for high schoolers when comparing to previous Lucas County data, and those being overweight staying about the same. Additionally, when comparing to 2016 and 2017 data, more youth are eating less food, going without eating, vomiting, and taking diet pills than the last assessment. An additional comparison table for the youth weight status is looking at fruit and vegetable consumption along with physical activity information. You can see less youth eating 4 or more servings of fruits and vegetables since the last assessment in 2016-2017, from 87% to 70%. And those that are not engaging in any physical activity increased by a few percentage points in 2019-2020. It's also important to note that we break down the youth data in the executive summary of the full Lucas County report. You can look across the table and see comparisons for the white, African American, and Latino populations. Again, as mentioned in previous slides, the black line is separating 6th through 12th graders, and then 9th through 12th graders on the right-hand side. On the left-hand side, those most likely to be overweight were the Latino population, also most likely to describe themselves as slightly overweight or very overweight. Additionally, in the full 6th through 12th grade population, we have the white population most likely to engage in physical activity every day. Also, African Americans were least likely to eat 1 to 4 servings of fruits and vegetables per day. Next, we are moving on to the youth tobacco use section. 3% of youth were current smokers, which is specifically looking at cigarette smoking. The CDC defines youth current smokers as having smoked cigarettes at least once in the past 30 days. 5% of youth tried cigarette smoking before the age of 13, and then the average age that youth started to smoke was 12.6 years old. E-cigarettes were the top form of tobacco used in the past year by Lucas County youth, which increased about 5 percentage points since the last Lucas County health assessment. Of Lucas County youth who reported using e-cigarettes or vapes in the past year, we know it's not just nicotine that youth are putting in them. We have 38% of youth putting marijuana or THC in their e-liquid. When asked how risky e-cigarette use is, 41% thought there was a great risk in harming themselves if they used them, and 13% of youth thought there were no risk in using electronic vapor products. Our comparison table is showing cigarette use at its all-time lowest, which is at 4% for Lucas County 9th through 12th graders. As you can see, at its highest, Lucas County was at 18% in 2011. It's pretty amazing to see that big of a change over the years. Additionally, you can see those first trying cigarette smoking before the age of 13 being pretty similar to previous Lucas County health assessments. For our minority tobacco use comparison table, we can see 9th through 12th grade Latinos were most likely to smoke cigarettes in the past month, defining them as current smokers. Next, we are looking at youth alcohol consumption, with 12% of youth drinking at least once in the past 30 days, which according to the CDC would be defined as a current drinker. The average age youth started to drink was 13.1 years old. We also look at binge drinking on this slide, with more than half of current drinkers saying they had an episode of binge drinking in the past month. Lastly, 4% of youth drivers had driven a car in the past month after they drank alcohol. On this slide, we're looking at where current youth drinkers are getting their alcohol from. The top responses were someone gave it to them, an older friend or sibling bought the alcohol for them, and then a parent gave it to them at 18%. When looking at our breakdown of youth who are current drinkers, again, drinking at least once in the past 30 days, 27% of those ages 17 and older were considered current drinkers. Also, we have a higher percentage of females when comparing to the male population. Next, we have some overall findings for our youth comparison table for alcohol consumption. Current drinkers are decreasing for the 9th through 12th population, with binge drinking staying about the same as the previous Lucas County health assessment. Additionally, youth riding with someone who had been drinking alcohol has also decreased, which is a positive finding and now below the United States percentage point. Next, we have the same comparison table, but looking at the minority populations for alcohol consumption. For high schoolers, current drinkers and binge drinkers were highest among the white population, but when looking at the full 6th through 12th grade data, this was highest for African Americans in Lucas County. Next, we move on to the drug use section for Lucas County youth, with 12% of youth using marijuana in the past month, and 6% reported trying marijuana before the age of 13. For youth who misused prescription medication, 62% reported a parent gave them the medications. You'll also see options including taking it from friends or family members or buying it from a friend. Our comparison table for youth drug use is showing almost every single indicator staying about the same since the last assessment in 2016 and 2017. This is specifically looking at 9th through 12th graders. All the Lucas County indicators for drug use are lower or the same as Ohio and national comparisons. Now looking at our minority drug use comparisons, Latinos in grades 6 through 12 had the highest marijuana use percentage. That's probably the most noteworthy difference in this slide. Also, ecstasy use doubled for the Latino population for 9th through 12th graders. The first table that you're looking at for the youth perception slide is showing youth who perceive there is a risk of harming themselves if they smoke cigarettes, use e-cigarettes, drink alcohol, use marijuana, and misuse prescription drugs. You'll see the highest perception of harm for misusing prescription drugs, which 74% of the 6th through 12th grade population believes there's a risk and harm if they misuse prescription drugs. A very similar question is on the bottom of the slide, but looking at if youth believe their parents would disapprove of any of those substances. Again, we see the highest percentage believing their parents would disapprove of them using prescription drugs. Smoking cigarettes was right behind misusing prescription medication at 78%. Our last perception slide is looking at if youth believe their friends would disapprove of them using any of the following substances. Similar to the previous slide, prescription drugs is the highest percentage for disapproval, followed by smoking cigarettes at 68%. Our next section is youth sexual behavior. Almost 1/5 of youth had sexual intercourse in their lifetime, with the average age of onset being 14.6 years old. Of those who reported being sexually active, 22% had intercourse by the age of 13. The first graph in this section is showing sexual intercourse in their lifetime, with the highest percentage being youth ages 17 and older. Additionally, you can see the decrease in those reporting having had sexual intercourse from the last assessment, where Lucas County was at 29%. You can see that as the darkest color on the right-hand side of the graph. Our comparison table is pretty large for this section. As previously mentioned, those having sexual intercourse decreased since the last assessment for 9th through 12th graders. Same with oral and anal sex. As you move down, most indicators decrease since the last assessment, for example, those using birth control pills as well as condom usage. For our minority trend summary table, those having sexual intercourse was highest for the white high school population. Also, those having sex with 4 or more people and having sexual intercourse before the age of 13 was highest for Lucas County Latinos. That is for both the full 6 through 12 and 9 through 12 categories. Our next section is youth mental health, with the first bullet looking at youth depression. 38% of youth reported feeling sad or hopeless almost every day for 2 weeks or more in a row that they stopped doing usual activities. This increased nearly 10% for females. Lucas County reported academic success was the #1 cause of anxiety, stress, or depression, and that was followed by death of a close friend or family member. Adverse childhood experiences have been a really hot topic recently. We also ask ACEs question in the other populations surveyed in Lucas County. 1 in 4 youth experience 3 or more ACEs, which are potentially traumatic experiences that affect health later in life. We included the top ACEs in this slide, but there are also additional ACEs in the full report under youth mental health. The top ACEs reported were parents becoming separated or divorced, and parents swearing at them, insulting them, or putting them down. This next slide is breaking down youth who seriously considered attempting suicide in the past year. You can see the highest percentage being those 17 and older, and additionally females also at 23%, which more than doubled the male population in Lucas County. Pretty similar to the previous slide, females and those 17 and older were most likely to actually attempt suicide. Overall, 10% of youth reported attempting suicide in the past year, which you will see is an increase of 3 percentage points since the last assessment in 2016-2017. The youth mental health comparison tables indicating both suicide contemplation and attempts, and also looking at youth depression. We can see both contemplation and suicide attempts increasing since the last assessment and are higher in Lucas County than the state of Ohio. We find the same thing with depression, which is that last indicator that you're looking at, increasing substantially since the 2016-2017 Lucas County assessment. Our minority mental health data is showing the highest suicide contemplation and attempts for the Latino population, and that is for both the 6th through 12th on the left-hand side of the comparison table and the right side, which is 9th through 12th graders. Next, we have our youth social determinants of health section. 7% of Lucas County youth felt emotionally upset with how they were treated due to their skin color. Sexual orientation came in at the second highest response. We also have youth feeling emotionally upset based on how they were treated due to their ethnicity, gender identity, culture, religion, and disability. There's similar information in the adult and child sections of the report to compare this question to other populations that were surveyed in Lucas County. We also have our comparisons at the bottom of this slide, with less youth visiting a dentist in the past year when comparing to both the state and the nation. You will see the exact same percentage as previous years for asthma diagnosis, with 24% of youth. Our last slide for social determinants of health, you'll see the first bullet showing in the past year, youth reported an adult discussed the following topics with them. We have the top 5 topics shown in this slide, but quite a lot of topics in the full section. The very first topic was goals for their future at 73%. Half discussed respecting themselves. We also have healthy ways to deal with stress and depression later in the list. At the bottom, we have 10% of youth reported gambling in their lifetime, and of those that reported gambling, 15% gambled with larger amounts of money to get the same excitement. Additionally, 6% reported that someone expressed concern about their gambling habits. Violence is our last youth section that we are reporting out on. First, we have bullying data with 1/3 of youth reporting they were bullied in the past year in any type of way. You'll see all the different types of bullying underneath this main question, with most saying that they were verbally or indirectly bullied. You'll also see cyberbullying, physical, and sexual bullying. Our trend summary for the violence section is showing an increase in 9th through 12th graders that were in a physical fight or being threatened or injured with a weapon on school property. We also have more students feeling unsafe at school or on their way to or from school in the past month. And then for our bullying indicators, overall bullying was decreasing a few percentage points, but bullying on school property remained the same and a bit higher than state and national data. Our last slide for youth violence is the minority comparison table. Our minority trend summaries are showing that 9th through 12th graders are not feeling safe to or from school, primarily for the Latino population having the highest percentage. Bullying was also highest for Latinos for the full 6th through 12th graders. African Americans carrying a weapon on school property was highest for 9th through 12th graders at 5% compared to 1% of the white population. Thank you for your time and your interest in the results of the youth data for the 2019-2020 Lucas County Community Health Assessment. Please remember to review additional sections of this presentation that you might be interested in, including the adult and child-specific sections. Of course, you can also check out the full report on Healthy Lucas County's website. Before we finish, I also want to encourage you to fill out a participant feedback survey with more information on the next slide. Here you'll see the link to our participant feedback survey, which is on the SurveyMonkey platform. We ask questions that will help the executive committee move forward with planning for their next community health improvement plan, which is the next step in this process. Thank you so much for your time.